Right. Welcome, guys, to our gross anatomy lecture. Today, we're going to talk about the posterior fascial compartment of the forearm. So, if you did not see the video for the anterior compartment, you better go and look for it. Right. So, today, we're going to talk about the contents, the muscles. If I mean the contents, I speak of the muscles, the blood supply, and the nerve supply of these muscles. So there are facts that you just need to understand. Right, relative to the anterior compartment is actually more bulk than the posterior compartment, right? The posterior compartment muscles, they are going to be innervated mainly by the branches of the radial nerve, right? So if you remember from the cubital fossa, we say that the radial nerve in the cubital fossa divided into two: a superficial branch and the deep branch. And it is the deep branch that pierces the substance that wind around the neck of the radius within the substance of the supinator muscle to get into the posterior compartment of the arm. Right. So let's start with muscles. Muscles. So from this video, I'm going to talk of the posterior compartment. Um, I'm not going to talk of the lateral compartment. There's gonna be a separate video for the lateral compartment, is it? So you're going to have what you call a common extensor origin. That's your lateral epicondylar. So there are gonna be muscles that originate from the lateral epicondyle. These muscles of the extensor compartment, they are divided into two. All right, you're actually going to have a superficial group of muscles and a deep group of muscles. Right. So let's take a look at the superficial group of muscles. Right. So we're going to start with the extensor carpi radialis brevis, extensor digitorum, extensor carpi ulnaris, the anconius. These are muscles which are found in the superficial group. So let's take a look at each one of them, just a summary, so that you'll be able to understand their origin and their insertion as well as their action. Right, so we said we have superficial and deep. We're going to start with the superficial. Take note, the superficial muscles, they have the same origin, which is the common extensor origin. That's your lateral epicondylar. We're going to start with the extensor carpi radialis brevis. We are not going to talk of the longus because the longus is part of the lateral compartment. So the extensor carpi radialis longus, it originates from the lateral epicondyle, right? And this muscle is actually going to insert into the base of the third metacarpal, right? The third metacarpal right here. That's where it's going to insert. It actually has two actions, definitely extending the wrist joint and abduction. Abduction. So it will abduct when it contracts. Done. We go to the extensor digitorum. So the extensor digitorum is actually an equivalent of the flexor digitorum profundus. This muscle, it actually um, lies under the extensor retinaculum, and then it's going to insert right into the middle and the distal phalanx, the middle and distal phalanx of the lateral, sorry, of the medial four digits. So this one and this one and this one, these are the insertion points of the extensor digitorum muscle. innervated by definitely the deep branch of the radius of the radial nerve. And then you're going to have your flexor carpi ulnaris muscle. The flexor carpi ulnaris muscle originates from the same common extensor origin, that's your lateral epicondylar, and then it will insert on the base of the 50 metacarpal, right? It actually has two action, one extension, obviously, and adduction, 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 innervated by the deep branch of the radial nerve, right? And then we're going to have a small muscle which is called an anconeus, right? We just originate from the lateral epicondyle, right here, and then inserts just on the lateral surface of the olecranon process of the ulna, right here. Right, this action, the action of this muscle, it actually extends the elbow. So when it contracts this direction, it extends the elbow, right? And then finally, we are going to have the supinator muscle. Remember the supinator muscle? That was actually forming the lateral floor of your cubital fossa, right? It actually originates, it's part of the superficial, right? And it originates, so it's part of the deep muscles, right? So we are going to look at it very soon. For the time being, let us focus on the superficial muscles. So this is a good diagram to illustrate the superficial muscle. I will not talk about the extensor carpi radialis longus and the brachioradialis longus. They are part of the lateral compartment. For the superficial, we have an anconeus, extensor carpi ulnaris, extensor digitorum, extensor digitorum, and extensor carpi radialis longus. These muscles, they are innervated by the deep branch of the radial nerve. Good. Let's take a look at the deep muscles of the extensor compartment. Right, so the deep muscles, they are actually very fascinating because they don't have a common origin. So you have to know each and every muscle, its in origin and its insertion. So we're actually going to start with the supinator muscle, which we the common, what is common up with the supinator muscle forms the lateral floor of the cubital fossa, remember, and it's actually pierced by the deep branch of the radial nerve. It has two heads, a superficial head and a deep head, right? And then it's going to insert on the neck and shaft of the radius. Neck and shaft of the radius. So you can actually see this, the deep head, they all insert on the neck and shaft of the radius. What is its action? Definitely supination, right? Supination of your forearm. From the supinator, you're actually going to have another muscle called your adductor pollicis longus. So remember, when you see the word pollicis, it's going to the thumb. So the adductor pollicis longus, it will attach to the base of the first metacarpal bone, right? And it's gonna be very important for abducting the thumb. Abducting the thumb. Take note of this, the adductor pollicis longus together with the extensor pollicis brevis, as we're gonna see, will actually form the lateral border of the anatomical snuff box. So this is your anatomical snuff box right here. This is gonna be your lateral border. This is gonna be your medial border, right? So another muscle is gonna be your extensor pollicis longus, your extensor pollicis brevis. Your extensor pollicis brevis, right, originating from the posterior surface of the shaft of the radius. You can actually see right here, and then it's going to insert on the base of the proximal phalanx of the thumb right here. You can actually see this one. So this is your proximal, right? Remember, the thumb has only two phalanx, a distal and a proximal. So the proximal, the base of the proximal is going to be the insertion for the extensor pollicis brevis, and together with the adductor pollicis longus will form the lateral border of the anatomical snuff box. We are going to have, if there's a brevis, there's going to be a longus, the extensor pollicis longus muscle, This is the longest because it will go and insert on the distal base of the phalanx of the thumb, right? What are the actions of the extensor pollicis brevis and extensor pollicis longus? They extend the thumb, right? So the brevis will actually extend mainly the metacarpopharyngeal joint of the thumb, whilst the longus will actually extend the distal phalanx, right, of the thumb, which would be the interphalangeal joint, right. Then the last muscle is going to be your extensor indicis. So extensor indicis, right, it inserts on the extensor expansion of the indicis finger, right here. This is your indicis, right? Good. So it's going to extend the metacarpopharyngeal joint of the indicis finger, or of the index finger, not the indices. This is the indices. This is the index finger. Index, right? So it's gonna be the index finger, right? Innervated by the indices muscle, right? So the index finger is gonna be attached by the extensor indicis muscle, right? Good. So this is gonna be a pinky finger or a little finger, not the indices finger. Sorry for that. So this one is the index finger receiving attachment from the extensor indicis muscle. Good. All these muscles, they are going to be innervated by the deep branch of the radial nerve. Let's take a look at the course of the radial nerve and the blood supply of the posterior compartment. Right. So you are going to have, this is the anterior portion, your radial nerve. It will pierce the lateral intermuscular septa of the arm, getting into the anterior compartment of the arm, right? It runs a lateral, superficial to the lateral epicondylar, right here, right? And then in the cubital fossa, it's actually going to terminate by giving a superficial branch of the radial nerve and the deep branch. So the deep branch is actually larger than the superficial branch. The deep branch is going to pierce, right, the supinator muscle to enter, or it's going to be within the 2 ears of the supinator muscle, right? So just for recap, the ulnar nerve passes between the 2 ears of the flexor carpi ulnaris, the median nerve passes between the 2 ears of the pronator teres, the radial nerve passes between the 2 ears of the supinator muscle, right? So it enters the posterior compartment right here, and then it's actually going to run between the superficial and the deep group, between the superficial group of muscles and the deep group, and innervating these muscles, right? As for the blood supply, remember you have the common interosseous artery, which will give an anterior interosseous and a posterior interosseous. So the posterior interosseous will actually run in the medial aspect of your radial nerve, your deep branch of the radial nerve, right? Take note, it is this the posterior interosseous artery which will be communicating with the anterior interosseous artery. So actually have some branches of the anterior interosseous artery actually anastomosing, actually supplying the posterior compartment of the arm, right? So that's actually very important.